Hawkins County Memorial Hospital by Group 1, Laurel Lane, Casey Griggs, and Alicia Waycaster. The background of Hawkins County Memorial Hospital is that it is a nonprofit voluntary short-term acute care hospital. It's located in Rogersville, Tennessee. It facilitates 52 staff beds, 46 of those are routine and 6 are special care. The hospital has served Rogersville, Tennessee and that area since 1961. This medical staff is made up entirely of board certified physicians. That means that these physicians are specialists in their fields. I know that a lot of specialty practices don't actually have board certified physicians, so that is a comfort measure that this hospital takes, so patients can be more comfortable and confident in the care that they get. Some important information about Hawkins. It's an affiliate of Ballad Health. It's also located again in Rogersville, Tennessee, founded in 1961 privately as a voluntary nonprofit organization. The services that they do include emergency care, physical therapy, pulmonology, surgery, intensive care, sleep medicine, and diagnostic imaging that includes CT, MRI, and nuclear medicine. Hawkins also offers outpatient specialty clinics for gastroenterology, spine and rehabilitation, podiatry, and ear, nose, and throat services. The rewards and certifications that Hawkins currently holds, they are accredited with the Joint Commission with full standards compliance. They also have been ranked among the top 10 in the nation for patient satisfaction and overall hospital care, overall medical care, and overall surgical care. Their board members are made up of both employees and volunteers who demonstrate their love for Hawkins County and the betterment of the community's health. Um, as the population that we serve includes underinsured, non-insured, and insured patients from all locations, and some special recognition to some industries in Rogersville that we appreciate for keeping the economy stable and keeping their group coming to us would be BAE Systems, Baldor Dodge Reliance, Short Mountain Silica, and Technic Glass. Hawkins County Memorial Hospital mission statement is to honor those we serve by delivering the best care possible, providing compassionate, accessible, high quality, and cost effective health care to the community, to promote health, to educate healthcare professionals, and to participate in appropriate clinical research. Our mission statement is short and sweet, but I think that it also encompasses everything that we want to as a hospital and as a foundation and as a leader and a provider in the community as well. The vision statement of Hawkins County Memorial Hospital is that we will be an innovative leader in health and wellness through our unsurpassed quality, clinical care, relentless spirit of inquiry, and compassion for our patients and their families. Our founding promise to the community is as valid today as it was had a half century ago when we were founded in 1961. We will care for everyone in our region regardless of their ability to pay. And some things that we kind of promise to do in the community is to practice the safest, most ethical, and effective medical care possible, to discover new treatments and cures through breakthrough research, promote healthy communities while reducing health disparities, empower our team members to reach their highest potential in a respectful work environment, educate and inspire the next generation of faculty, staff, and leaders, and then build a culture of generosity for patient care and research.
Our values include creativity, caring, honesty, respect, faith, and quality. By conducting an internal SWOT analysis, we were able to identify our organization's strengths, which include accessibility, because we offer 24-hour emergency services, as well as accessible hours for outpatient services. Our clinics are affordable. We offer low-cost, high-quality care, as well as a sliding scale discount based on income. We have very comprehensive services, organizational and staff longevity, a cohesive board and staff. Our board members and staff work well together, with the number one concern being the care of our patients and community. We're viewed in a positive light by our community. In 2016, we were recognized as being among the top 10% of the hospitals in the nation. We have a very well-maintained facility. We have friendly, compassionate staff, strong leadership. We're driven by our mission, and we have a low staff turnover and strong retention rates. By conducting an internal SWOT analysis, we were also able to identify our weaknesses as an organization, which include poor communication. Due to the large amount of staff, it can be difficult to disperse information. We have weaknesses in areas such as marketing and outreach. We have a relatively high expense structure and a low income patient demographic. By conducting a SWOT, we were able to identify external environmental opportunities and threats. Opportunities include telemedicine expansion, increased marketing efforts, focus on reducing costs and improving utilization of services, develop a mentor and fellowship programs for upcoming MDs and DOs, increase access to specialty clinics, opportunity for community members to serve as volunteers, interest in wellness activities and complementary services. For threats, we identified politics, national policy, rising costs of healthcare and drugs, declining population, and challenges with physician and provider recruitment. We have identified the following goals for our organization: maintain competition within the market, maintain low turnover rates by incorporating career ladder and employee incentives, remain financially stable throughout the fiscal year, and continue to respond to our patient needs and improve overall patient satisfaction. For our organization, we chose objectives that relate to communication barriers with staff, patients, services, marketing, outreach, and finances. Our objectives are specific, measurable, attainable, relevant, and time-based. Our first objective is to eliminate communication barriers among staff. We will improve communication throughout our organization by having monthly departmental staff meetings. We will also create a monthly newsletter that will be sent out via email to all staff, which will highlight key information. This objective is measurable through quarterly staff surveys. During these surveys, we will assess if staff feel communication is improving and if the meetings are helpful. Department managers will also be gauging employee responses around meetings and communication. This objective is attainable if we continue to put efforts towards improving communication. This is relevant to our organization because we want staff to feel informed. We will begin the process of scheduling our staff meetings this month with a goal of our first staff meeting being April 10th. Staff meetings will continue to be held on the second Wednesday of each month. We will conduct our first staff survey in July to assess progress. Newsletters will be sent out the first day of each month, starting in May. Our second objective is to increase our marketing and outreach efforts. We want to begin marketing and outreach to our community by running advertisements about our organization in the local newspaper, as well as having a billboard. We will begin measuring the effectiveness of our marketing and outreach by tracking the number of new patients at our ambulatory care clinics, as well as conducting patient surveys. This is relevant to our organization because we want our community to know we are here to serve their healthcare needs. We will begin marketing and outreach efforts May 1st and assess our progress in August. Our third objective is to eliminate unnecessary allocation of departmental budgets. We will improve the use of departmental budgets by monitoring the monthly use of funds. Monthly and quarterly budget monitoring will occur. The CFO and departmental managers will be responsible for tracking. This objective is attainable if managers track and monitor all impacts and uses to their department's budget. This is relevant to our organization because unnecessary and inefficient use of funds can have a negative effect on the financial stability of our organization. We will begin budget monitoring on 3/11 with a goal to improve over the next quarter. Our action plan for Objective 1 is to improve communication with staff through monthly departmental staff meetings and newsletter. Process for improving begins now. In order to accomplish this objective, departmental meetings need to be scheduled for the entire calendar year, a template for the newsletter needs to be designed, and periodic monitoring will be conducted through staff surveys. Our action plan for Objective 2 is to begin running newspaper advertisements and have a billboard in place by May 1st, 2019. In order to accomplish this objective, we need to hire a marketing and outreach manager to design the billboard and write up the newspaper advertisements. We will measure our progress in August of 2019. Our action plan for Objective 3 is to monitor departmental budgets for unnecessary expenses, which is in progress now. We will assess budgets next quarter. In order to accomplish this objective, our financial officer will assess budget monitoring to determine necessary and unnecessary spending from each department. Objectives require evaluation and monitoring to ensure each objective and strategy are on target and aiming for success. For Objective 1, we will evaluate our progress for this objective and strategy by conducting quarterly staff surveys to assess if staff feel communication is improving and if meetings are helpful. In order to monitor this objective, data will be collected through staff surveys quarterly and compiled into percentages. So, for example, percentage of employees that feel meetings are effective versus percentage of employees who feel meetings are ineffective. The COO is responsible for conducting employee surveys and analyzing the data. The CEO, COO, and departmental managers will receive this data analysis. For Objective 2, we will evaluate our progress by running reports to track the number of new patients at our ambulatory clinics. We will also conduct patient surveys which will ask patients how they heard about our clinics, which will then tell us if our marketing efforts are effective. For monitoring, we will collect data through our EMR reports and patient satisfaction surveys. Reports from our EMR will track the number of new patients at each ambulatory clinic. We will monitor this monthly. Surveys will be compiled into percentages, so percent of patients that heard about us through a billboard versus newspaper versus other methods. The COO is responsible for ensuring patient surveys are conducted by the front office staff and analyzing the data. Our COO will also pull data for the number of new patients at each ambulatory site. The CEO, COO, and departmental managers will receive this data analysis. For Objective 3, we will evaluate our progress by having the CFO assess budgets each quarter. During this assessment, the CFO will determine if unnecessary spending is still occurring, and if so, in which department. For monitoring, data will be collected through departmental budget evaluations and compiled in an Excel where the CFO can compare expenses by department. The CFO is responsible for budget monitoring and analyzing the data. The CEO, COO, and CFO will receive this data analysis.